One of the hottest topics right now in wound care is skin substitutes and biologic dressings. What are they, and is your loved one a candidate? I'm Bienstock, and I'm a board-certified plastic and reconstructive surgeon. My specialty and interest is wound care in the homebound and bedbound. Today we're going to talk about skin substitutes and biologic dressings. Well, what are these? Generally, they're not skin substitutes, meaning they're skin grafts from your own tissue. These are tissue that's been processed either from amniotic tissue or placental tissue that has non-viable cells, and it serves as a matrix, meaning like a scaffold to help with wound healing. It's been indicated for chronic wounds. So only Medicare is the only insurance that covers it, unless people want to pay out of pocket, but it becomes very exorbitant. I've had experience with skin substitutes. I've used it on chronic wounds, meaning wounds that are several months to years old that have not responded to classic treatment after multiple debridements, negative pressure therapy, topical oxygen therapy, and just have stagnated. And what do I do in those patients? Those are patients I felt have been good candidates, particularly for pressure ulcers of the hip and sacrum. Now, right now, it appears that the skin substitutes for the sacrum are considered experimental. They're used for lower extremity wounds or other wounds, but it appears for the sacrum they're no longer indicated by Medicare. Obviously, the rules change with government insurance. We have to the rules change on a daily basis. They become a hot topic in the media due to their exorbitant payment. It doesn't mean they should not be used. It just means some people are overusing them. I can't comment on this, but I'm sure there are many physicians who are really not skilled in wound care that are just using them willy-nilly, and I've seen this in several patients in terms of they've been used inappropriately and led to a significant wound infection and sepsis, and I've taken care of one of these patients. So I don't want to think that it's not indicated at all, but you have to be really careful. You have to really have exhaustive options. Meaning you can't use an acute wounds, meaning wounds that are under 30 days old. You have to make sure all the underlying issues which we've talked about have been addressed, which is nutrition and adequate turning. A lot of times those issues are not adequately addressed, and the skin substitute is really not going to work. It's also very difficult to apply a type of graft when it's or biologic graft, not from your own cell, but from processed tissue, and to keep it secure and devoid of poop. Meaning you have to make it a waterproof seal because it has to stay in place for at least 3 to 5 days, sometimes a week. You can imagine if you're trying to put it on the coccyx area to keep that clean and dry, devoid of stool or fecal material as well as urine, it becomes very challenging. The ways to do this are using a lot of adhesives, using waterproof dressings, and I reinforce with something called Duoderm, which is an excellent dressing in keeping water, urine, and other materials out, as well as maintaining an adequate seal. I think it's a great option. I've used it in several of my patients. However, I do think it's been abused by some physicians who are really trying to only do it for economic incentive. We may see a change in January of 2026 due to the reimbursement, since it doesn't appear that Medicare is going to be able to afford these. As I said, I'm neutral about this. I think there are many indications to use them, particularly in chronic wounds that haven't responded after debridements, adequate wound care, and cleansing. I think it's being abused in certain scenarios, and there has to be more, rather than reduce the payment on these. I do honestly believe, as a plastic surgeon, they should be looking at the appropriate algorithms when it should and should not be used. If you have any questions, concerns, or comments about skin substitutes or biologic dressings, please let me know. Make sure you subscribe to the channel and share it with your friends and colleagues, and I look forward to our next session. Thank you.